So for my lightning strike presentation, I am going to talk to y'all about uh, pediatric baseball players with partial ulnar collateral ligament tears, and I am comparing Tommy John surgery, which would be seen kind of as an extreme in this case, to platelet-rich plasma injections. And the outcome of this PICO question would be that the platelet-rich plasma injections is a better option for treatment in the partial UCL tears, especially for pediatrics. The incidence of pediatric elbow injury is actually very high. Approximately 75% of children between 5 and 15 participate in organized sports, and 11% undergo intensive training. Of course, there's many health benefits to this, but also it is the number one cause of injury in school. Sports account for about 19 to 29% of hospital emergency visits, especially in the U.S. In baseball, in particular, when talking about ulnar collateral ligament tears, 18 to 69% of all players report some sort of elbow pain. And when you think about how 2 million children participate in Little League every year, that's an astonishing number. With reports of elbow pain, the pitchers report about 58% of pitchers report of it, catchers 63%, and fielders 47%. Mostly medial ulnar collateral ligament tears happen to pitchers. The injury results from cumulative microtrauma from the repetitive overhead throwing motion used in pitching. Particularly, high school students has seen a drastic rise in the number of UCL reconstructions performed throughout the entirety of the U.S. It has been noted that there's been about a 50% increase between 1995 and 2003 with high school age pitchers undergoing UCL reconstruction. In high school baseball in general, most UCL injuries become apparent in one single throw, in which a popping or a tearing sensation in the elbow is accompanied by immediate pain. Now, that would be a full tear. When we're talking about partial tears, they could feel the popping and the tearing, but there's also they could go through just swelling and a little bit of laxity and just constant pain that gets worse and worse the more they throw. The go-to fix for UCL tears is Tommy John surgery. That's what everybody talks about, Tommy John surgery. Now, Tommy John surgery does have an incredible return to play rate. About 83% of MLB pitchers who undergo UCL reconstruction return back fully to pitching within a year and a half. However, this is probably not the best case for a partial tear when considering pediatric patients. Tommy John surgery is very invasive. It requires the drilling of 3 holes into the epicondyle of the humerus, along with getting a tendinous graft from either somewhere else on the patient's body or a cadaver graft. It sometimes even involves the moving of the ulnar nerve, which could affect the child for much longer and later in his life, and definitely could affect his chances of going far in baseball. The Tommy John surgery has a very high success rate, as I've said, but the complication rate post-op is about 21%. There's also concerns with the strength of the suture after the surgery is done. The graft being tight enough across the elbow or too tight. And then when you think about pediatrics, they're always growing. Their bones are lengthening, their muscles are getting stronger, weaker. They're going through shifts and changes in their body. To have something so permanent done at such a young age, there's almost certainly going to be complications down the road with the stretching of the graft and maybe the pulling at the drill holes, and or even a detachment of the flexor origin of the graft. Popular for adults, UCL injuries. Tommy John is very popular for adults, but for adolescents, it doesn't seem to be the best choice. It also requires a very intense rehabilitation period, which may not be followed by the pediatric athletes, considering school and jobs and looking at colleges. It may not be thought all the way through. Now, the other option for the partial UCL tears in pediatrics is the platelet-rich plasma injection. It has been shown that platelet-rich plasma does heal damaged tissues. Now, the platelets are small particles in the blood, and they are responsible for hemostasis, construction of new connective tissue, and revascularization. And recently it has been found that platelets release many bioactive proteins which promote the removal of necrotic tissue and enhance tissue regeneration and healing. Platelet-rich plasma patients should be able to return to play sooner and without the risks and significant rehabilitation periods associated with the surgery. Like I said, reopening of sutures, the drilling of the holes in the epicondyles, all of these risks not happening with the platelet-rich plasma. Also, the platelet-rich plasma is autogenic. It comes from your own blood, so the chance of the body attacking this intervention is null and void. The body's not going to attack itself. So, in this way, a study was done where 34 athletes with partial thickness UCL tears were all given this platelet-rich plasma injection, and the 30 of the 34%, the 34 athletes, which is an 88%, returned to the same level of play without any complaints. They full health, same level of play. The results of this study indicate that the platelet-rich plasma is definitely an effective option to successfully treat partial UCL tears of the elbow in athletes. So, in conclusion, while Tommy John is a very good surgery and it has been through many trials and errors and it has gone and proven itself with, especially at the MLB level, it is not the only option for treatment of UCL tears, especially partial UCL tears, where, yes, maybe regular rehab didn't work and you needed that extra boost that the platelet-rich plasma could give. With the self-healing that the platelet-rich plasma doesn't inhibit, gives life to, it really is a great option for this case, especially when talking about pediatrics and how the intensive surgery and could cause many problems down the road. Yeah.